Hello friends, how are you? This is Dr. Cidambi. I am a psychiatrist from the United States of America. As I promised you guys, I'm back with the next episode of paraphilias. One of the paraphilias that we are going to talk in this video is about frotteuristic disorder. Frotteurism is an important topic, right? And so we're going to talk about everything regarding frotteurism today. So before we jump into this video, don't forget to subscribe and press on the bell button. With that, let's get started. Frotteuristic disorder or frotteurism. What is this? It is one of the several paraphilias or sexually arousing disorders, right? What is that? It is the act of touching or rubbing one's genitals against non-suspecting or unsuspecting, non-consenting people. This happens mostly in crowded areas, like in the bars, in the railway stations, in the supermarkets, sometimes even on crowded streets, right? People go behind the unsuspected people and they kind of grind their private parts, like genitals, against other person's, non-consenting person's backside, and kind of disappear from them quickly. And because that is the easy way to run away after they do this kind of a legally not acceptable. It's an illegal act. So this happens, and this is one of the kind of paraphilia that we are talking about. I mentioned about 8 different types of paraphilias, and so one of them is the frotteuristic disorder. The frotterer is the person who is rubbing against non-consenting people, right? These frotterers are doing this because they get this sexual pleasure in a public place, the private excitement, sexually arousing act that happens in a public place. So this can be consistent fantasies, urges, or even the act of rubbing against non-consenting people in a period of 6 months or more. Then we call this and we diagnose this as a frotteuristic disorder. So now, when do we see this kind of illness? First and foremost, it doesn't happen before the age of 12 because there is no maturity and the kid does not know, the sexual arousal from this. So anywhere between the teenage, 15 years to 25 years of age is when we really see this disorder unfold. But as they age, we already spoke about all paraphilias kind of go down by age 60. And the reason being that the hormonal drop really helps it. Once again, paraphilias are more common among men, but that doesn't mean that women don't suffer from this, right? The treatments do differ between a male and a female patient. So why do people have this? In their brain, they have problems with the serotonin, and that leads to obsession and compulsions. So they have these thoughts, the urges, the fantasies to go ahead and do this kind of rubbing against non-consenting, unsuspecting people, and that gives them the pleasure. This happens because these children are not able to make a reasonable relationship in their lives, and they don't have consenting partners, or they may even be married, but they're not really having that satisfaction in that relationship. So these are the foundation, these are the root cause. But we really don't know what exactly causes Frotteuristic disorder. What leads to paraphilia? There are only theories. We don't know exactly the linkage. There are many different theories. And also they were saying something from their childhood could lead to this. And one really interesting fact is that if someone accidentally gets this experience of rubbing or touching body parts of another person, and that kind of gives them an arousal, sexual arousal, this kind of reinforces the brain. And then they succumb to this kind of fantasies. They think, accidentally this happened, but I kind of like this. This gives me a sexual arousal. And so they end up seeking this kind of thrill-seeking behavior, and that becomes the paraphilia, frotteuristic disorder. So these are all the theories, and we don't have, as I said, direct linkage. A causes B. That's not what we can say about any of these paraphilias. Now, we spoke about what are the reasons, what happens in the brain, and what is the process in itself. What is this all about, right? So why are they doing this? This is because these people have these fantasies, the urges, and the compulsions. The brain is like asking them to go. Persistent thoughts. It's annoying them. They get out every day, putting themselves into these crowded areas just to experience this sexual gratification, the arousal. Without that, they don't get the complete sexual arousal. And so this is the only way they can achieve it. It's a really sad thing if you were to look at these people. And do they ask for treatment? Do they come forward to seek treatment? Hell no. Because they don't get caught. They do what they do and they disappear. And in the next day, they continue to do it. So it's a self-gratifying behavior up until they get caught for some other legal, bigger sexual assault. And then you find out they've had these paraphilias. And there are other paraphilias associated with the frotteuristic disorder. What are they? It could be voyeurism or flashing. So we will talk about this in the next few videos of paraphilias, right? So for now, we just have to remember these are all like clubbed together in a person. This is really painful. It's extremely painful for both the person who was a frotterer and also those people who have been a victim of this act. The ones who are victim, and there is a victim impact. You might think they didn't get raped, they didn't get penetrated. There was nothing major. It was just a rubbing. But can you imagine being that victim? What is the victim impact on that? It's such a big thing, whether it's a male or a female. And most times we'll be thinking, oh my God, these guys are rubbing against women. You'll be surprised. Vice versa happens. So when a woman suffers from this, we give them medroxyprogesterone. And when a male suffers from this, hormonal treatments are given by giving anti-androgens. And also there is a fluoxetine, which is an SSRI. And if you can really ask for help in a timely manner, you can get the appropriate help. Please use this information and seek out for treatment. With that, I'll see you again. Thank you. Have a nice one. Bye-bye.